My name is Brooke Habiger. I'm going to be doing the IV piggyback with the back flush method. I would go ahead and gather all my supplies. I have my MAR. We're going to be adding a IV piggyback of 1 gram of Cefoxitin, 100 milliliters over 45 minutes. Doing the math, converting it over, we're going to do 133 milliliters per hour per my doctor's orders. I would go ahead and make sure to check my doctor's orders, check my patient's allergies, make sure to gather all my supplies. With IV piggybacks, you want to make sure that you're checking that it's going to go well with the IV solution that you have already hanging for the patient that's continuous. Make sure that they will work with each other, not against. You have your solution, we have our secondary tubing, we have alcohol pad, we have some tape, some gauze if need be, pen. So we would go ahead and once we did all that, go in the patient's room. We're going to go ahead and knock, we're going to go and introduce ourselves, make sure to check the patient's ID band, perform hand hygiene, go ahead and explain the procedure to them. Once you're doing that, you're going to go ahead and gather all your supplies. You don't need gloves for this unless it's contradicted, unless they're in like isolation, then you would probably want to wear gloves. So what I'm going to do is I'm going to go ahead and label my solution first. With the IV piggyback, you're going to make sure that you do the 5 rights 3 times as well. You can go ahead and do that. And you can label your tubing as well, so we'll get that ready. Okay. So opening up my container, we have our blue hook. So immediately I'm going to go ahead and drop this down so that is hanging. Then I'm going to go ahead and grab my secondary tubing. I do not have my blue cap on it, so this blue cap would come on it because we need to keep that sterile. We're also going to want to make sure that we're keeping the other end sterile as well. And we're going to go ahead and make sure to close the roller clamp. Like I said, keep these 2 parts sterile. You're going to go ahead and open up your alcohol swab. You're going to go ahead and take your alcohol swab. You're going to go ahead and cleanse this port because this port has been open to the air, the particles, people touching it. You're going to make sure that you clean this port off. Once that is cleaned, go ahead and take your blue cap off and press down and twist. From here, you're going to go ahead and take this cap off. You're going to go ahead and spike your IV piggyback. So once you have it hanging, it will not fill up until you do the back flush method. We're going to go ahead and open up the tubing. We're going to drop it below. Once that fills up to the desired level that you need, you're going to go ahead and bring it above your primary. And then you're going to go over and you're going to make sure that you are setting up your secondary pump for the IV piggyback. You're going to go ahead and hit down here. So you're going to hit the select rate. The rate was 133. The total of it is going to be how much is in there, which is 100 milliliters. And then we're going to hit start for your secondary start. And then that will start pumping. And then before you leave, you're going to want to make sure that you are watching this flow through, which I have my primary tubing closed so it will not get everywhere. You're going to make sure that this is pumping down and make sure that it is dripping correctly.